Living with Diabetes, an everyday guide for you and your family, is a cutting-edge learning tool patients can use to learn to take charge of their diabetes. Developed by physicians, nurses, educators, and most importantly, patients, this guide focuses on helping patients change their behavior, not just learn about their diabetes. Doctors or office staff can use this guide to help patients make action plans, or small, easily achievable steps that help them change behavior. First, go over the guide with the patient. It's friendly, easy to read, and has lots of pictures. Ask the patient, what is one area of your health that you are ready to make a change in? Your job is to help patients narrow down their goals to a very specific and achievable plan. Keep in mind, the patient is in charge. Meet Gloria. Like many patients, Gloria really doesn't know how to start or what to do. How's your diabetes been?
It's not where I would like for it to be.
Have you thought about some ways that you could start getting it under better control?
Well, yes, losing some weight probably would help.
You know, I have this guide for you today that can give you some ideas about how to take better control of your diabetes. Is there anything that you've been thinking of that might help you get started?
Well, I thought about some walking.
Good. Well, here's our physical activity chapter that gives you lots of ideas of how to stay active.
Oh boy, that looks great. You know, dancing. I used to love to dance when I was younger, so that's possibly something I could do.
How many days of the next week do you think you'll be able to start dancing?
Oh, I would say 3 days.
3 days. And how long do you think you'd be able to do it for?
30 minutes.
30
I
minutes.
think I could.
Great. So on a scale of 1 to 10, how sure are you that you'll be able to do 30 minutes of dancing 3 days of the next week?
Probably a 5.
A 5. I want to be absolutely sure this is something that you're going to be able to do. What might get in your way?
I don't know. 30 minutes is a long time.
How can you make that action plan a little bit more doable for you?
Maybe we'll do 2 songs.
2
3
songs.
times a week.
Perfect. So on a scale of 1 to 10, how sure are you that you can dance for 2 songs 3 days of the next week?
I would say an 8.
As you can tell, Gloria was ready to make a change and decided on something she knew she could do. But not all patients are that easy. Here's Kim.
Do you think there's anything you could do this week that would help you manage your sugar and your diabetes?
Well, I can't give up desserts. So, I don't know. You tell me.
Well, it's all about taking baby steps, so think about something small you could do.
How about if I cut them in half? Maybe cut my desserts in half and have just half of what I normally have.
Okay, well that sounds really good. How often would you be able to do that?
Oh, I can do that every night. Hello?
Hi, Ms. Hall.
Yes,
Hi, this is Crystalline at the clinic. How are you?
I'm fine. How are you?
I'm good. Well, I was just calling to check on you to see how you did with your action plan last week. How was it?
Oh, it was okay the first couple of nights, and after that it was really tough.
That's a good start. But let's see if we can get you to a more achievable action plan. What do you think you'll be able to do?
I was thinking sugar-free desserts might work better.
Okay, sugar-free desserts. Well, how many times next week do you think you'll be able to do that?
Oh, 3 times, and my husband will never even know.
Okay. Well, from a scale of 1 to 10, how likely are you able to do that?
A 7?
Okay, great. We have you doing sugar-free desserts 3 times next week. Is that okay?
Yes.
Okay, well, we'll check back in with you.
Thank you.
Sometimes patients may be so enthusiastic they make an action plan that is too difficult. Meet Walter.
And what this guide focuses on is getting started with your diabetes, eating right, being more active, checking your blood sugar.
Being more active.
Being more active? What do you
Yeah.
think you could do to be more active?
Setups. When I was in the Army, 100 was no problem.
Great. And how many days a week would you like to do that?
Oh, maybe 3.
3 days a week. So 100 sit-ups 3 days a week. So on a scale of 1 to 10, 10 being the most confident, how confident do you think that you can do that?
5.
A 5? Okay, well what do you think we could do to increase your confidence level?
Well, let's lower the rep down to maybe 20.
20. That sounds great. 20 sit-ups for 3 days a week.
Helping patients come up with their own action plan is key. Your job is to help patients create an action plan that is specific and easily achievable. It's important that patients are very sure that they can complete their action plans. Completing an action plan gives patients confidence and makes them feel like they can make more changes. This guide may help patients all on its own, but when you combine it with an action plan, the guide becomes a powerful way to change behavior.